Students. So last class I have discussed regarding the assessment part of the cancer. So today we'll see. I told you no cancer detection mostly in the males and the females. We have two procedures that selfly we can do by ourselves. So that is breast self examination in females and testicular examination in the males. Now we'll see breast self examination. So you all know the breast, it has an important role in the modern culture, often used measured of sexuality, femininity and attractiveness because it is visible for its size and shape. You all know all these things. So however it is a secondary sexual characteristics, it is a physiological function in. So breast is very much important for the females because after thing it will be helpful for the milk secretion for the milk for the infant babies. So 90% of the women are having so experiences has verified that 90% of breast cancers are found by women themselves. See what happened is, so we can find our abnormality in the breast. That means we can do self examination, so that 90% can detect our problems only. See that much important of this breast self examination. When women discover lumps in their breast, so because it's a private part, if anything happened also, we won't we will not go for the doctor because of shyness, isn't it? So it's better first you only perform this, then if you find any problem, then you can go to the doctors. So every woman at least for 1 year, once a year they can do this breast self examination. So discover lumps in their breast at a very early stages, so surgery can be have 70 to 80% of prevent cases. So if you find lumps in your breast, little bit lumps in your breast, then definitely it has a 60 to 70% it has a chance of cureness, because first stage only you are identifying and you are taking treatment, so you are can be detected. And next thing is, all women aged 20 years and older perform breast self examination on a monthly basis. Mostly women the age of 20 or above, so they can do this breast self examination even on the monthly basis. So beginning in their 20s, women should be told about the benefits and limitations. So when they are teenage only, that time only we have to educate them regarding this breast self examination and importance of how to do examination and how much it is important. So what are the symptoms that they can notice while doing the breast self, that all you have to be educate the woman. And women ages 29 to 39 should have clinical examination every 3 years, because nowadays most of the women are having the cancer problems, breast cancer and the uh, that uterus cancer. So see, recently also I have seen in the news that mostly 10 people in 10 women, one are suffering with any type of cancers, mostly breast cancer. So because of this reason, we have to, as a 29 to 39, they should go for a periodical checking for the cancer. And a woman ages of 40 years and older have regular mammography. So a 40 above they can do the mammography. So see, uneducated means we can't do all these things, but as educated we have to do all these things, so that we can detect our problem, so that we can get treatment. So symptomatic women ages 40 and older should be continue to receive clinical breast self examination. So asymptomatic women who are having ages 40 can, so who are having nothing symptoms, no problems, very healthy persons, then they after 40 also they can do the breast self examination every month. So screening decisions for older women should be individualized by the consider the potential, because why we have to do for senior women ante, they we can detect the problems in the mammography, so also can be have the health status. So as long as the woman health is good, so and would be candidate for treatment, she could continue to be screened with mammography. So after when she got breast cancer, after treatment also she has to go continuously for screening and mammography. What is advantages of this breast self examination? Women can use breast self examination to assess their breast. When they perform breast self examination properly and regularly, they cannot any changes in their breast and seek further evaluation. So examination should be done every month at the end of menses in all menstrual women. So when the menstrual cycle is ending, that means some people will have 4 days, 5 days. So at the last day you can perform this breast self examination so that it can be easily palpate. So barrier, what is a barrier? Means which is stopping the woman not to do breast self examination is nothing but lack of confidence or illiterate, uneducated. They don't know how to do breast self examination. But as a nursing personnel, we can do, and we have to educate the other people to do this breast self examination. So what are the things that before doing what we can assess? First of all, before doing the breast self examination, we have to know what we can find out, isn't it? So what are the uses that you can get by doing breast self examination? So mostly two times we can do this breast self inspection and the palpation. You all know physical examination process lo inspection and the palpation. So inspection in the sense how the symmetry of the breast, whether it is full, round, smooth, and without any dumplings, retractions, or masses. These have to be seen. Faint, even vascular pattern or striae are noted. So any striae are there or faint are there, that all you have to be noted. And nipples are averted, areolar even. So axillary even color without masses or any rash. So this can be detected in the during the breast self examination. So complete axilla part and your breast should be in a even, there is no rashes or there is no any masses, there is no any color changes anamata. And firm and without masses, lumps, local areas with warmth or tenderness. Nipple should not have any discharges. Axilla should be smooth and noded and are non-palpable. So axilla should be very smooth, noded, and nothing should be there if you do the breast self examination, because you know axilla we have lymph nodes, isn't it? If any cancer related to breast, it can transfer to the easily to the axillary node. So that's why you have to do the nodal examination in the axillary part. So assessment interview. So sexual health history. Are you currently sexually active? So before doing any breast self examination, you have to keep it in all these question and answers anamata. So are you currently sexually active with man, woman, or both? So whether you are having a or sexual partner or any negative aspects of your sexual functioning. So do you have any difficulty with sexual desire, and do you have experiences with all the sexual history? You have to be noted in the, because as this is also one of the reproductive organ, you have to see the sexual health history. And next thing is breast history. So whether it is pain, tenderness, any discharges, any lumps, okay, where it is located, what is the shape of it, consistency, any redness, any nipple discharge, any masses, that all you have to be seen the, you can ask the person whether they are having anything or not. And along with the breast, we have to see the um, we have to see amount of color and discharges also. So along with the breast, you have to see axillary nodes also. Ask for the history of breast cancer in, because I told you, no, it is a genetic one. If mothers is having, definitely the children will come. So that's why you have to ask the family history of breast cancer. So identifying clients at risk. So before that, you have to identify the clients. So any sexual assault people, burns people, or sexually problematic people, or physically impaired people, and who was having more stress people, and sexual lack of knowledge, altered structure, body or function due to trauma, pregnancy, childbirth. These all people you have to be identify, and you can do this breast self examination. So signs of breast cancer: see elevation, retraction or indentation of nipple, and elevation, asymmetry, bleeding, orange peel skin, nipple retraction. So these are the signs of breast cancer. So women are screened for breast cancer in three ways. One is mammography, and these all are the pictures, clinical breast examination, second one, third one is breast self examination. So clinical breast examination can be done by the doctors, and mammography can be taken in the diagnostic findings. Breast self examination a woman can do own at their home. And one more thing is that biopsy, if any more doubts are there, so you can take one tissue and send for laboratory diagnostic for testing. So classification of tumors, you all know stages 1 to 4. One is only it present to localized and no nodal. Second one is it is nodal positive, and third one is it is spreaded more, and fourth one is it is metastasized. So whatever the any condition related to cancer, so you have to be write the stages of cancer. So anything you have to write same thing. Okay, if it is breast, related to breast area, if it is lung, related to lung area, like that you have to be, whenever you are writing the cancer, no, that you have to be write this one. And steps in breast self examination, so inspection before a minor palpation, lying position, palpation. So these are the steps that we have to do. First thing is inspection before a mirror. Palpation, you should lie on the bed and you have to do. Other palpation you can do sitting or standing. So inspection, see this, the person is standing in front of the mirror, so should face, you have to be undressed your thing, and you have to stand in front of the mirror and you have to check how the two breasts are, and right side and left side, any changes that you have to see it. So you have to keep your both hands on the hip part, okay, so that you can see your chest part will be fronted and you can clearly see any problem. And next thing is you have to be bent by while standing only, you have to bend towards and you have to check for any abnormalities. So stand with arms and look for any free movement of the breast over the chest wall. Why? Because these all, they should not have any lumps are there, no, so they won't move. If lumps are not there, they can easily movable. And press your arms firmly together at the chin level or at the with the elbow raised to the, nothing but raise your hands, both hands up, and you see the breast. And palpation, lying position, so these three can be done while standing position. And palpation in lying position, you have to be uh, lie down on the bed, and you have to put the pillow under your which side you are palpating, no, that side you have to keep the pillow, and with the help of your hand you have to opposite hand, okay, if you are doing with right side, left hand you have to palpate the breast tissue and chest wall, and what are the curves, whether it are the breasts are normal or not, you have to put. And you with fingers also you have to see the nipple area, okay, and along with that you can see the nodal area also clearly. So see this diagram, you can understand easily how you have to do the palpation in lying position. So one more palpation in standing position, only one raising hand. So whichever side you are want to examine, that side hand you have to raise, and with the opposite hand you have to palpate like this. So if you find any masses or any lumps, so definitely you can observe. So you can put soapy hands also for easily, when you are doing shower, no, because of soapy your skin will be more smooth and soft, so easily you can palpable. And the next, see, this is about the breast self examination. Three types of, three: standing in position, and sleeping position, and also lying and upright position. Okay, so by this we can do the breast self examination. So next class we will see the testicular examination.